And today we will talk some important things that caregivers to stroke patients need to know. And what are some of these things? One, they need to know what a stroke is. Remember, a stroke is a disease condition where there is a disturbance of blood supply to a part of the brain. And there are two major kinds. You have ischemic and hemorrhagic strokes. An ischemic stroke is a stroke where there is a blockage of a blood supply to a part of the brain, which may result from a blood clot, a piece of fat, or even air. And a hemorrhagic stroke is a stroke where there's a rupture of a blood vessel, which commonly occurs in some disease conditions like poorly controlled hypertension. And this may obstruct or disturb blood supply to a part of the brain. Two, they need to know how the stroke is affecting their loved ones, because the part of the brain that has been affected determines the kind of deficit that's going to occur in the body of the person. This will help them not to give wrong labels to their family members, as some may say this person is not collaborating, is not cooperating, maybe he's wicked, whereas it's a result of the part of the brain that has been affected, causing a deficit in the person's behavior. Next, they also need to understand that physical care to this loved one is very important. They need to always keep the body of this loved one clean, so dirt doesn't accumulate on the person's body that may cause infections to occur and bring about other diseases. Mobility of the loved one is also important. They need to encourage the person to move those active parts of the body, especially those that are not as active as they used to be. And if very challenging, they need to be engaged in passive range of motion, where they would themselves cause movements to occur on that part of the body that is not acting effectively, with the advice of the physiotherapist. Next, they need to know that prevention of another stroke is very important, because when a second stroke occurs, it can compromise management and make it very difficult to recover. By this, they need to make sure there is strict adherence to drug therapy. The loved one living with a stroke needs to regularly visit the health facility. They need to ensure that the blood pressure, blood sugar, or whatsoever are under good control. They also should also ensure that there is good lifestyle modification in the loved one. So if there were some practices that were increasing this risk, those practices need to be adjusted. They should also understand that adequate nutrition and hydration is very important. So they make sure the loved one is eating nutritious food and having enough quantities of water to drink on a daily basis, because poor nutrition can compromise care and make it difficult to recover. Inadequate hydration, not drinking enough quantities of water daily, can also compromise care. They should understand also that the loved one will be better fed in the upright position, and if they are feeding or giving water to the loved one to eat or drink, and the person starts to choke, this can be an indication that the person is aspirating. That is, the food or water may be going along the airway instead of going into the esophagus or the gullet to go into the stomach. And so they need to arrest the feeding at that level. And after feeding, allow the loved one to be in an upright position for a while before lying. The good communication is also important to the loved one. Even if the person is having challenges to speak, possibly due to the part of the brain that has been affected, they should tolerate this loved one and give room for the person to make efforts to speak. This will also help to speed up a recovery. Good safety measures at home are also important, so they don't keep objects like buckets, chairs that the person can stumble on and also fall. And the house should also be well lighted. They also need to be schooled or receive some education on how to move their loved ones while on bed in case of a person who can't turn himself or herself from the bed. This would reduce the risk of the development of bed sores because of much pressure on some parts of the body. Bed sores, I mean here, wounds developing on some parts of the body, which can further compromise care. So the person needs to be turned every 2 hours in case of a person who can't move himself on the bed. The loved one should also understand that this person has a high risk to go into a state of depression, where the things that used to be of great interest to this person, the person may lose interest in any of these things. And since the person may no longer be able to carry out these activities in the family or in the community, the person can easily go into a state of depression. And so they need to know these things and always engage the person in discussions that won't allow their loved ones to go into a state of depression. This is very important. For going into a state of depression can further compromise care.